Segment of Delmarva Life is brought to you by Peninsula Home Care.
The pandemic has many of us staying home, limiting any unnecessary trips. But if you have an accident, say a trip that leads to a fall or worse, you are probably looking at several weeks of physical therapy to recover. Now, the thought of heading out while injured may have you feeling a little uneasy. Well, it shouldn't. That's because you can get that important therapy without leaving the comfort of your own home. And it's all thanks to Peninsula Home Care. In the blink of an eye.
I was just in a hurry.
A split second.
And I tripped over a little footstool.
Is the pain right over here?
Sherry White of Salisbury fell.
Fell very hard.
Leaving Sherry with a fractured shoulder, a torn rotator cuff, and an injury to her right leg.
So the whole right side of me is like useless.
Upon leaving the hospital, Sherry knew she would need physical therapy, but she didn't know it would be done in her home.
I had no idea.
She says she assumed the first visit was an evaluation, and then she would have to travel to therapy.
And when I found out they were not only going to do the evaluation, they were going to do physical therapy and occupational therapy, and they would continue to come to the home, I was delighted.
And tell me when to stop. Should be strong but comfortable.
That's when she met Rod Fielart.
She's been wonderful from the get-go.
Rod is a physical therapist with Peninsula Home Care.
When I explained it to her when I came that I'll be doing physical therapy evaluation, this is what I'm going to do and this is what I'm going to expect from you. And she's been very participative with therapy.
For Sherry, he's a godsend.
Because the thoughts of trying to get myself together to go out, to get into a vehicle, first of all, I wasn't able to walk very well. I wasn't able to get dressed very well. I certainly couldn't drive, but to have my husband be available to take me 3 times a week to therapy, it just seemed like it was overwhelming.
All the way to the door.
It's a solid relationship.
Well, Rod is a nice young man. We were pleased that, we could have had some old grumpy guy,
And that's important when there's hard work to be done.
I say he's my taskmaster, that he's bring his whip today, but he's got, I think, the right blend of, it takes compassion, but it also takes a sternness, he needs for me to do the exercises, and they're not pleasant, they hurt, no pain, no gain,
The good thing about it is she's very honest when it comes also to how she feels, which is very important for us physical therapists in order to be able to address their condition and how to help them. She tells me this is what my pain level is, and then I'll try to educate her, and she's been very compliant.
It's that give and take that makes therapy work for Sherry.
I already have seen a significant difference in my arm. Unfortunately, I haven't a lot in my leg yet, but I anticipate, that it will get better. When you have such pain, and if you didn't go to therapy, it would be so easy to just lay back and say, I don't want to move it.
Rod says healing is a process, and understanding that process is important.
It has to go through different stages of healing, from restorative to preventive stages, and we are there to help them along the way.
He says that process seems to go better when the patients are in their own home.
They are more relaxed because they're at the comfort of their home.
But Sherry is quick to say she's ready for it all to be over.
Oh my goodness, I'm impatient. Patience is not one of my virtues. My husband will tell you that. I'm used to being independent. I don't like having to ask him for every little thing. I don't like having to ask anybody. I drop my phone and Rod or Wilson just has to go get it for me. It just is something that I look forward to, is getting back to.
A goal Rod shares.
That's the ultimate feeling, really, is, if I see them get better and, they're smiling, they're walking, and they're happy, they're moving well, and they're doing their exercises, it's the ultimate feeling. That's the best reward that I can get from the patients.
Sherry has another goal: to be more careful.
And I will watch where I put that footstool, let me tell you. In fact, it may already be gone from the house. I haven't seen it since I fell.
Another advantage to having home physical therapy: physical therapists assess each home to determine medical equipment needs and how to manipulate the layout to reduce a patient's risk for falling again.